Now, next important topic is the virulence factors of microbes. Alright, so virulence factors are nothing but, you know, those structural components of microorganisms or certain proteins produced by them which help the microorganisms to harm the host, to cause disease in the host. In other words, they can be referred to as the arms and ammunitions of microorganisms. And it's very, very important to have a knowledge about this, because if we know about the virulence factors, then we can come up with certain ways to evade the infection by specific microorganisms, or we can condition our immune system to manufacture some substances which can counter or neutralize these virulence factors, so that the host is protected against tissue damage which is caused by these virulence factors. Now, before discussing the virulence factors per se, you need to understand some important terms which are C, I and D. Okay, it is not the CID which we see on Sony television. Instead, for us in microbiology, in clinical microbiology, do remember CID as colonization, infection and disease. We need to understand these terms first, C, I and D. Now, what does colonization mean? Colonization means that the microorganisms are simply multiplying on an external surface like the skin, or an internal surface like some mucosal lining, without any kind of tissue invasion. Okay, so it means the microbes multiply on an external surface, that is the skin, or internal surface, that is some mucosal membrane. The key word in the definition is without tissue invasion. Okay, without disturbing the host. Alright, so when there is no tissue invasion, do you expect any kind of immune response by the host in the form of antibodies or any immunologically competent cells? No. Okay, because merely colonization is happening, nobody is getting, the host is not getting harmed. Now, what does infection mean? Infection means the microbes multiply on some external or internal surface of the body, on external or internal surface, but this time with tissue invasion. But the good news over here is this degree or extent of tissue invasion is not enough to produce clinical signs and symptoms in the patient. Okay, so even though tissue invasion is happening, this invasion is not enough to cause any signs or symptoms. The person is asymptomatic. Alright, but because tissue invasion is happening, because there is tissue invasion, so what do we expect? Immune response is present in the form of antibodies or immunologically competent cells. So, immune response is present in case of infection, and because of this immune response, actually there is no signs and symptoms. Okay, whereas in case of colonization, because there is no tissue invasion, therefore there is no immune response. Why should the immune response waste its time and resources when no disturbance at all is happening in case of colonization? Alright, now coming to the third term, that is disease. Over here, what is the story? The microbes multiply on an external or internal surface with tissue invasion, which is enough to cause signs and symptoms in the host. Alright, so the degree of tissue invasion could be large, or the microorganism itself could be very powerful, in the sense that it might be producing very, lethal kind of virulence factors, which cannot be, taken care of by the immune system. The immune system becomes overwhelmed, so the patient gives in the sense that the patient will now manifest some kind of symptoms and signs. Okay, so the tissue invasion is big enough to cause signs and symptoms in the host. Now, because tissue invasion is present, okay, again over here also we expect some kind of immune response by the host. Okay, because when the host is getting disturbed in the form of tissue invasion by the microorganisms, the immune system, guys, is not going to keep quiet. Okay, the immune system is our friend. Okay, remember I told previously also, we are never alone. Okay, we do have our commensals with us, which also are a part of our immunity. All right, so nobody is ever alone. We are living with millions of commensal organisms which are a part of our immune system. And again, there are other components to immunity also, in the form of B cells, T cells, etc., all of which will collectively collaborate or conspire against the pathogenic organisms which are trying to disturb us in the form of tissue invasion. Okay. Now, classical example of these terms, the infection and disease which I can give over here is that of Mycobacterium tuberculosis. Now, guys, Mycobacterium tuberculosis, with this organism, 1/3 population in India is infected. Okay, is infected. Remember, when we say infected, we mean that this 1/3 of population is having the organism in the body, and the organism is also causing tissue invasion. But thankfully, this tissue invasion is not to a very great extent. It is only up to a certain extent, so that the immune system is taking care of these infected people, and these infected people do not manifest any signs and symptoms in the form of fever, cough, weight loss, etc. All right. But if suppose the immunity of any of these 1/3 of individuals who are infected, if some of these people happen to become immunocompromised because of some reason, for instance, if somebody is an alcoholic, if some other individual gets infected with human immunodeficiency virus, okay, or there is some other reason which jeopardizes the immunity of these infected individuals, now what will happen? Now Mycobacterium tuberculosis will have an advantage, in the sense that because the immunity is decreased, the Mycobacterium tuberculosis will now, which was till now so far was getting suppressed by the immune system. Now this organism, the Mycobacterium tuberculosis, will start to cause tissue damage. So now these infected people will start manifesting signs and symptoms, and then we say that these infected people have landed up with disease, active disease. Okay, so some of these infected people, in some of these infected people, if immunity decreases, what happens? Disease sets in. These infected people in whom we are saying that disease is going to set in, now these people could develop fever, cough, productive sputum, and now these people will become infectious to others. Okay, so remember, being infected is not same as being infectious. Both are different things. All right. So with this background regarding these terms, colonization, infection and disease, now I'll jump to the topic per se, that is virulence factors of microbes. Now the virulence factors, first and foremost, we have got adhesins. We have discussed this in bacterial cell structure or anatomy as well, and we all know that they are of two kinds, fimbriae, also known as pili, and teichoic acid, respectively present in gram-negative bacteria and gram-positive bacteria. Okay, so these are the adhesins. And now I am going to give you some important examples of microbes which possess these adhesins. The adhesins for these microorganisms are so very important that if you remove adhesins from these microorganisms, they will become totally powerless. Okay, they won't be able to disturb the host. They will no longer remain harmful. They will become absolutely harmless. The best example is gonococcus, that is Neisseria gonorrhoeae. Now this organism has pili which help it to attach to urethral and endocervical epithelium. Remember, pili are so very important in case of gonococci that we say apeliated, meaning apeliated gonococci, meaning those gonococci from which you have removed the pili. These apeliated gonococci are avirulent. Okay, are avirulent. Virulence simply refers to the ability of a microorganism to cause disease in us. Okay, so avirulent means a lack of ability to cause virulence or disease. Then this is one example. Then the other important example is uropathogenic Escherichia coli. Uropathogenic Escherichia coli, which cause urinary tract infection or UTI. These organisms, they attach to the uroepithelial cells via what is known as P pili. Now, what does P in the phrase P pili mean? This P actually refers to the P blood group antigen, P blood group antigen, which is expressed on the surface of uroepithelial cells. Okay, uroepithelial cells. So these are two important examples I have given you as far as adhesins are concerned. Moving ahead, the second important virulence factor is capsule. Now guys, in bacterial cell structure or anatomy, we already have discussed what is meant by a capsule and the related terms like slime and glycocalyx. Alright. Now capsule is said to be a virulence factor. Why? Because capsule resists phagocytosis. Okay. Now phagocytosis is what? Phagocytosis literally means cell eating. Okay, our immune system has got certain important soldiers or members which protect us in the sense that they are able to carry out a very important process called as phagocytosis, wherein they are literally going to eat up microorganisms and the dead cells and the debris which is constantly getting produced in our body. Okay, so we have got two important phagocytic cells, that is the neutrophils and the macrophages, right? But our immune system faces a challenging task whenever we get infected by an organism which has got the capsule, because it is very tough phagocytosis to happen in case of capsulated organisms. So this is what is meant by the capsule resisting phagocytosis, or in other words we can also say that the capsule is antiphagocytic. It's a big problem for our phagocytic cells, that is the neutrophils and the macrophages, whenever they encounter a capsulated organism. And what is the reason behind this? Who makes capsules so powerful? Remember, the capsule is antiphagocytic, or it resists phagocytosis because number one, the negative charges on the cell membrane of the phagocytic cells, that is neutrophils and macrophages, these negative charges are repelled by the negative charges present on the capsule. The capsule also is decorated with negative charges. Negative will repel each other. So what happens, the capsulated organism, it apart from the phagocytic cells. So the phagocytic cells like neutrophils and macrophages are not able to grab the microorganism, the capsulated microorganism. And the second reason is, we have seen that the capsule in most of the organisms is made up of polysaccharide, and polysaccharide is a very sticky substance. Okay, so the capsule is sticky in nature. So this is another reason why it becomes a daunting or challenging task for the neutrophils and macrophages to catch hold of the capsulated microorganism. That is how the capsule is able to the capsulated organisms are able to resist phagocytosis. Now, examples of important capsulated organisms we already have covered before during bacterial cell anatomy or structure. Then thirdly, third important virulence factor is antigenic variation. Antigenic variation. Now, what does this mean? Now, imagine this is a bacterium. Okay, say this is a microbe, this is a bacterium, it has infected a human being, right? Now, this bacterium is having certain molecules on its surface. See, as a whole, this bacterium is a foreign body only for the person in whom this infection has occurred. Okay, because bacterium is it's a cell, it's a living organism. It's going to be made up of different kinds of proteins, carbohydrates. It's going to have DNA also. Now, the surface of this bacterium, which is perceived or seen by the immune system. So the surface molecules are the molecules which are going to be first seen by the immune system. So the immune system, by gauging or looking at those surface molecules, the immune system will respond by producing certain countering substance against those bacterial molecules. For example, some antibodies or some immunologically competent cells. So for example, suppose this bacterium has got these triangles on its surface. These are the surface antigens, right? Antigens are nothing but foreign substances which irritate the immune system so that the immune system is able to produce antibodies. So guys, what will happen? So these triangles are the surface antigens. When this bacterium infects a person, the person will respond. If suppose, pardon me for the drawing, okay, this is a human. This bacterium is going to infect the human. Now, how will the human respond? The human being will not keep quiet. The human being will respond. The immune system of the human being will respond by recognizing these triangles and producing antibodies like this. Okay, so these antibodies will go and bind to these triangles, something like this. Okay. See guys, just like a lock can be opened by a specific key only, similarly, the antibodies which have been produced in response to a specific type or the shape of an antigen, those antibodies are going to attach or bind to only that antigen and no other antigen. Alright, so looking at this picture so far, we can see that, so what if the bacterium has infected, the human being has done a good job by producing antibodies against those triangles, but there's a problem. This bacterium is very smart. There are not only over smart human beings, but there are also over smart microorganisms. Now, this fellow, this bacterium is now grinning. Previously, it was smiling. Now, it is grinning from ear to ear. You know why? Now, it is going to change or produce variable antigens. It is literally going to change these triangles into these oval structures. Okay, like this. A very good analogy over here which I can think of is if any of you is an avid watcher of Ekta Kapoor serials. In her serials, many a times it has happened that one actor leaves the show and then she introduces some other actor, and the explanation given in the serial is there was road traffic accident and the face was disfigured and the plastic surgery has been done. Okay, so you can just keep that analogy in mind, that this bacterium is, sort of undergoing plastic surgery, in the sense that it is changing its surface antigens from triangles to these oval molecules, all right. And keeping in mind the general rule that the antibodies which have been produced against a particular type or shape of antigen are not going to entertain any other antigen. So these antibodies are not at all going to bind to these changed antigens. So that is why, this bacterium is now smiling even more, because these surface antigens have shown variation. This we call it as antigenic variation, and because of this antigenic variation, now our immune system has to do all the hard work from scratch, because now it is required for the immune system to produce absolutely new kind of antibodies for these new oval antigens. Okay, so these are the new antigens or the changed antigens. So that is why those organisms which show antigenic variation, these organisms tend to cause chronic infections. Okay, chronic persistent infections which are very tough to treat. They take a lot more time to heal. Next, you need to know the important examples of microbes which show antigenic variation. For instance, human immunodeficiency virus, that is HIV, this is one example. Then Borrelia recurrentis, which causes relapsing fever. The relapses of fever are because because of antigenic variation. Then we have got Trypanosoma brucei, which causes sleeping sickness. Then of course we have got influenza viruses, notorious for showing antigenic variation. Then we have also got Giardia lamblia, also known as Giardia intestinalis, also known as Giardia duodenalis. Alright, these are some of the important, medically important microorganisms which show antigenic variation. And one more point, guys, apart from these organisms causing chronic, persistent, tough to treat infections, it is very tough to create vaccines against such organisms which show antigenic variation, because you can imagine when these organisms are going to change their antigens so rapidly. If suppose you have created one vaccine targeting a particular antigen, and sadly if the organism changes its antigen, and that new organism with the new antigen is prevalent in the community, then the vaccine will fail. Alright, so that's another problem with these organisms. So this is the third virulence factor, that is antigenic variation. Then next, fourth is intracellular survival. Intracellular survival. Now guys, in immunology we are going to understand that there are two broad types of immunity: the humoral immunity, which is mediated by antibodies, and the cellular immunity, which is mediated by T cells and the macrophages. Okay, so remember, immunity could be humoral, that is antibody mediated, or it could be cellular by virtue of cells like T cells, macrophages. Now, humoral immunity is important, or it is needed for extracellular organisms, okay, meaning those organisms which are going to just stay outside the cells, and these extracellular organisms are harmful because they are going to produce enzymes and toxins which are then going to attack or bombard the cells. These organisms are not directly harming the cells, but they are throwing bombs or grenades in the form of toxins and enzymes and other virulence factors which are then going to attack the host cell. But the good thing about these extracellular organisms is they do not penetrate or enter the host cell, so they can be easily targeted by antibodies, because even antibodies are not going to penetrate inside the cells. They are going to take care of these extracellular organisms which are also going to stay outside the cells. Now, whereas on the other hand, we also need cell mediated immunity or cellular immunity, for intracellular organisms. Okay, because once an organism has invaded or gained entry inside a host cell, then antibodies will become useless, because antibodies are not going to invade the host cell to reach the intracellular organism. Okay, so in a way we can say that intracellular survival provides an extra edge to the microorganisms, because by becoming intracellular they can at least escape or evade from one very important type of immunity, that is humoral or antibody mediated immunity. Alright. So as far as intracellular organisms or intracellular survival is concerned, we have got two categories. Okay, so the intracellular organisms can be of two types: facultative intracellular and obligate intracellular. Now, what is meant by facultative intracellular? If you recall the discussion on oxygen requirements of microorganisms, there I explained a term called as facultative anaerobe, and I mentioned that facultative anaerobe should not convey the message that it's an anaerobe. It's actually an aerobic organism, but it has got the facility or the luxury or the blessing to survive even if oxygen is not there. So it is referred to as facultative intracellular. Same principle applies to this phrase also. The facultative intracellular organisms are basically extracellular, but given a chance they can invade the cells and they can hide inside the cells. So that is why they are referred to as facultative intracellular. Okay, so basically in a nutshell, facultative intracellular organisms can survive both inside the cells and outside the cells. Now, to remember the important examples of these kind of organisms, I want you all to remember two important degrees. One is MS and the other one is LLB. MS and LLB. Okay, these two degrees you should remember, and these should help you recall the names of the facultative intracellular microorganisms, that is Mycobacterium tuberculosis. Okay, you can remember this as an MS surgeon is also pursuing LLB. Okay, so M is Mycobacterium tuberculosis, S is Salmonella, L stands for Listeria monocytogenes, second L stands for Legionella pneumophila, and B stands for Brucella. Alright. So an MS doctor pursuing LLB, so both the medicine degree and the law degree. So keep in mind the analogy, these organisms are both intracellular as well as extracellular. They can survive both inside and outside the cells. Then what about obligate intracellular organisms? Now these are those organisms which have to grow inside a living cell, inside a cell only. Okay, they cannot survive outside. The best example is, remember it as MRC. Now, MRC should remind you of Medical Research Council. Now, imagine there is a very dedicated student who is doing some kind of research, and he is a member of the Medical Research Council. He is into put his heart and soul into research, so much so that 24/7 he likes to stay in his or her research lab only, does not like to go out at all. So it is an obligation for that student to stay inside the lab to pursue his or her research work. So remember obligate intracellular in that context. So MRC for us is Mycobacterium leprae. R stands for Rickettsia and C stands for Chlamydia. Alright, so obligate intracellular are MRC and facultative intracellular, the two degrees MS and LLB. Then the next valence factor, enzymes. Now there are several enzymes which are going to be of use to certain microorganisms, with the help of which they are going to harm humans. Okay, so the best example over here is that of the urease enzyme. a very special enzyme produced by Helicobacter pylori, and we are going to see in clinical bacteriology modules how exactly H. pylori is able to survive in the gastric antrum, where pH is in the range of 2 to 3. Okay, as we discussed before, extremes of pH, alkaline or acidic, are detrimental to microorganisms, yet this special microorganism Helicobacter pylori is able to survive the extreme acidic condition of the stomach by virtue of producing urease enzyme. Okay, this is just one example of an enzyme produced by a microorganism. Many more enzymes we are going to discuss in detail with different bacteria. All right, then next virulence factor, toxins. Now guys, toxins are the poisonous substances produced by bacteria. All right, so broadly we can categorize toxins as exotoxins and endotoxins. Okay, endotoxin or LPS we already have discussed during bacterial cell structure or anatomy. Okay, and we are going to now understand about exotoxins also by comparing them with the endotoxins. Now guys, first and foremost, exotoxins are proteins and endotoxins, as you all know, they are lipopolysaccharides or LPS. Okay, now biochemistry knowledge, which of these two are going to be heat labile, proteins or LPS? Of course, proteins are going to be heat labile, so exotoxins are heat labile, that is HL, whereas endotoxins are heat stable, that is HS. Even if you forget, just remember LPS has got S and LPS is HS, that is heat stable. So S and S you should remember. Now exotoxins, exo means outside. As the name implies, exotoxins are secreted out into the environment by the bacteria, and exotoxins are nothing but proteins manufactured by a bacteria, and they are produced by both gram positive and gram negative bacteria. Okay, so exotoxins are actively secreted out into the environment, into the localized tissue where the organism has infected, okay, into the localized area or the local environment during life of a bacterium, whereas endotoxin is released, as we have discussed, on the death of bacterium, since endotoxin is a part and parcel of the gram negative bacterial cell structure. Endotoxins are present where? They are present in the outer membrane of gram negative bacteria. The only exception to this rule is Listeria monocytogenes, which is the only gram positive bacterium which has got endotoxin in its structure. That also we have discussed before. Now exotoxins, on the other hand, they can be produced by some gram positive bacteria and some gram negative bacteria. Okay, not all gram positive or gram negative are going to produce exotoxin. Some important gram positive organisms and some important gram negative organisms are going to be exotoxin producers. Okay, so these are produced by, we can say, both G plus bacteria and G minus bacteria. Now next point of difference, exotoxins we said are proteins, and remember, proteins are the best ever antigens. Okay, we are going to see in immunology the types of antigens based on a lot of features. One of them is the chemical structure. Remember, a good antigen is said to be an antigen which, when enters the body, irritates our immune system, or I should say inspires our immune system to produce antibodies against that antigen. Okay, and amongst all the different kind of organic molecules we have, like proteins, carbohydrates, lipids, nucleic acids, the best kind of antigens are proteins. So we say exotoxins are highly antigenic. Exotoxins are highly antigenic, whereas endotoxins are poor antigens. Okay, they are poor antigens. Now, because exotoxins are highly antigenic, therefore increased titer of antibodies is produced in response to them. Titer or concentration of antibodies is produced in response to exotoxins. In other words, there is a good immune response generated against them. On the other hand, in case of endotoxins, there is, because they are poor antigens, hence there is decreased titer of antibody production, decreased titer of antibodies produced, so it's poor immune response. Poor immune response. Now, exotoxins, each exotoxin binds to a unique receptor on the host. Okay, so there are several different kinds of exotoxins, and each of the exotoxins binds to a different receptor, okay, located in different tissues. So different exotoxins are expected to produce different kind of clinical features. Some exotoxins are going to produce diarrhea, some will cause constipation, some will cause flaccid paralysis, some will cause spastic paralysis. So every exotoxin binds to a unique receptor on the host cells. Therefore, the different varieties or types of exotoxins produce different clinical features, whereas in case of endotoxin, we already have seen that the toxic part is lipid A. Remember, lipid A is the A1 villain or the toxic part of endotoxin, which is same in structure in different gram-negative organisms. So the endotoxins of all the gram-negative organisms are going to produce the same constellation of signs and symptoms in a patient. Okay, so endotoxins of different gram-negative bacteria produce the same clinical features. That is a generic term we use for these clinical features: endotoxic shock or gram-negative shock. Remember that chart which I have discussed, how macrophages complement tissue factor is activated. Okay, all those are the signs and symptoms like fever, hypotension, edema, okay, neutrophil chemotaxis, etc., which we have discussed before. Next important point of difference is exotoxins can be toxoided, whereas endotoxins cannot be toxoided. Now, exotoxins are highly potent, whereas endotoxins are less potent. They are less potent. Now, potency is a term which you will understand in pharmacology. Now, to understand potency, let me give you an example. Suppose this is an enemy, okay, and there are two teams, team A and team B. Now, team A has got 2 members, team B has got 1 member, okay. Both of them wish to attack this enemy, okay. Now, team A needs 2 of its team members to attack or kill the enemy, whereas team B, which anyways has 1 member, the team B, in team B 1 member is enough to eliminate or eradicate this one enemy. So, which team is more potent? It is team B which is more potent, okay. So what is meant by potency? Potency is nothing but it's a measure of the competence of the toxin to produce the same type of effect. How much amount of toxin is needed, that is that is reflective of what is known as potency. If to produce a particular amount of effect, less amount of toxin is needed, then that toxin is said to be more potent, okay. So to target this one enemy, 2 team members of team A are needed as compared to only 1 team member of team B. So we say that team B is more potent in comparison to team A, okay. The effect to be produced over here is elimination of this enemy. So to produce the same effect, more number of people from team A are required as compared to team B. So team B is more potent. Now the example of a highly potent exotoxin is the botulinum toxin, which is by far, the most potent exotoxin known. It is the most potent exotoxin known. Okay, it's few grams only can kill, half of the population of Delhi. Okay, it's so much potent. With the botulinum toxin, it is produced by which bacterium? It is produced by Clostridium botulinum. Clostridium, again gram positive organism, Clostridium botulinum. Okay, we are going to see many examples of exotoxins as we discuss clinical bacteriology modules. So guys, this is about the virulence factors of microbes.